Welcome to the webinar for Federal Changes in Commercial Tobacco Control for Tribal Communities. My name is Mata Sano, and I will be moderating the discussion. I currently serve as a Prevention and Policy Coordinator at the American Indian Cancer Foundation through a Public Health Associates program funded by the CDC. I will introduce our panelists shortly, but before we begin, it's important to acknowledge the land and hear the traditional name of the territory in which we occupy. Indigenous people are consistently relegated to the past, including the narratives of the struggles that have been faced since colonization. And it's easy to deny Indigenous people their rights if the struggles are kept in the past and therefore denied in the present. So as we discuss our work towards advancing health equity, I want to take the opportunity to address that Indigenous rights must be rooted in this work. We'd like to take a moment to acknowledge the traditional ancestor land of the Dakota people, of where we currently are in the Twin Cities. So if you'd like to join us for a quick moment of silence. Thank you. Today, our panelists will be discussing amendments made to the Family Smoking Prevention and Control Act of 2009 that set the minimal legal sales age of all commercial tobacco products in the US and territories and on all tribal tobacco lands from 18 to 21, sorry. The resources that we will be discussing will be linked in the chat for your reference. And please note the distinction between commercial tobacco products that we will be discussing in the webinar, which are those that are manufactured by by tobacco companies for recreational use, and traditional tobacco products that many American Indians use for sacred purposes. And ACAF will touch on that in a moment. But without further ado, here are our panelists for today. I also welcome you all to drop your names and your where you're from and your affiliation in the chat as I introduce our panelists. So first we have Chris Johnson. He is a Prevention and Policy Manager at the American Indian Cancer Foundation. He is an enrolled member of the Sisseton, Wahpeton, Oyate. Next, we have Daanis Chosa, who is the Senior Program Specialist for the Prevention and Policy Team at the American Indian Cancer Foundation. She is originally from Keweenaw Ojibwe community in Michigan and is currently enrolled in the Bois Forte Band of Chippewa. Lastly, here we have Natalie Hemmerich, who is a staff attorney at the Public Health Law Center in Minnesota. So here are our lovely panelists for today. Just as Stephanie had mentioned, if you have any questions, please be sure to drop them in the Q&A box as we move forward. And to begin, I just wanted to give our panelists an opportunity to kind of talk a little bit more about what the Tobacco Control Act of 2009 is, I should say.
Yes, so in 2009, Congress passed and President Obama signed into law the Family Smoking Prevention and Tobacco Control Act. And I think some people might be surprised to know that, there is no comprehensive federal regulation of the production and sale of commercial tobacco prior to that law being passed. And so what it created was a system where the FDA would establish a new department within their agency called the Center for Tobacco Products, and they would be tasked with sort of controlling the environment of what commercial tobacco products look like. So they could say which products could be on the market and which products couldn't be on the market. They also can say, they can establish things like what's called product standards, where they can say no products can have this chemical or this additive in them. And they also are tasked with enforcing the minimum legal sales age, which at the time was 18 and is now was risen to 21 by another act of Congress. And so they do the retail enforcement all over in the United States. Well, they contract with different organizations or states to do retail enforcement for them all over the United States, including territories and tribal lands within the United States.
Thank you. And as you're talking about that, Natalie, I wonder if you can go into a little bit more about like how, if this legislation does apply in tribal lands.
Yeah, exactly. So the Tobacco Control Act specifically does apply to tribal lands because it's within the act, it specifically contemplates that this applies to tribal lands and says that within the act. And so although tribes are sovereign nations, there is a relationship between the laws, federal laws that are passed, and tribes. And so sometimes even federal laws that are passed are applicable on tribal lands, especially if they specifically contemplate that they are applicable on tribal lands. So it means that no retailer, regardless of where they're located in the United States, including on tribal lands, should be selling to anyone under the age of 21, and they should be checking IDs for anyone that appears to be at least for anyone that appears to be younger than 30. Yes. I don't know if Chris or Daanis want to say something else about tribal sovereignty, which I didn't get
Yeah,
into.
I can piggyback off of what you were saying. So we do know that a lot of different states have already done tobacco 21 within their regions, but this, like Natalie said, is effective at the federal level, so impacting a lot of the tribal lands. And so we wanted to touch on tribal sovereignty, and that tribal sovereignty is that inherent right to govern and protect and enhance the health, safety, and welfare of tribal citizens within their individual tribal territories. And so we know that tribal nations also have both the right and the authority to regulate their lands independently from state governments, which may lead to different state and tribal laws. And so a lot of times when states have done those tobacco 21 initiatives, the tribal nations were left out of that. And so this update to this legislation is really important in that it includes that the tribal nations within that. And so we just wanted to share a little bit on tribal sovereignty. And I think I'll also throw in a link in the chat for those of you who may be interested in more information around tribal sovereignty.
All right, thank you. Can you please talk about what type of products might be included in this legislation? If it's just limited to what type of commercial tobacco products would be seen?
Yeah, so I can share a little bit on that as well. So this law applies to all commercial tobacco products made or derived from tobacco. And so really this is defined by the FDA. And so this includes combustible tobacco products, things like cigarettes, cigars, cigarillos, and little cigars, as well as electronic tobacco products, things like electronic cigarettes or e-cigs, vapes, Juul, liquid nicotine, vape mods, things like that. And then it also includes other smokeless tobacco, so things like chewing tobacco, snuff, and then also those other commercial tobacco products like shisha or snus or roll your own tobacco. So it's really important that we note that this legislation does not apply to traditional tobacco. And so when we think about the differences between commercial and traditional, I know Mata kind of alluded to this in the introduction. So, commercial is really that stuff you find in the store, whereas the traditional tobacco is really, it's grown and harvested within tribal communities, and, the cultural traditions and, harvesting and gathering, all of those different practices will vary between tribal communities, and, even within a tribal community, those might look a little different as well. And so we just wanted to put in, mention that this isn't applying to traditional tobacco.
And then I think just speaking on commercial tobacco, could you talk about maybe from a public health standpoint, like what some of the benefits of such a legislation would be if enforced on tribal land?
Yeah, sure. So I guess one of the biggest reasons, and this goes back to the background that you were talking about earlier, the federal government was really pushed to increase the Minnesota or the minimum legal smoking age because of the recent youth e-cig epidemic. And this is because from 2011 to 2019, the past 30-day use of e-cigarettes by high schoolers dramatically increased from 1.5 to 27.5%, which is about 4.1 million youth cigarette users nationwide, which is huge. And American Indian youth were found to use e-cigarettes at a much higher rate compared to other non-natives throughout many regions of the United States. And just according to keepitsacred.org, National Native Network we partner with frequently, they say that commercial tobacco initiation often begins earlier for Native youth compared to other races, and that's beginning in their preteen years, and then regular smoking begins during their teenage years. Another, I guess, reason for importance for this legislation is that e-cigarette companies have specifically targeted tribals with harmful and addictive products that falsely disguised as smoking cessation products, and then furthering and perpetuating nicotine addiction in tribal communities. And also using nicotine in adolescents can permanently alter the neurological pathways in the developing brain, making nicotine addiction stronger and harder to break. And then smoking commercial tobacco, according to some of the data out there in our TTUP, is responsible for nearly 90% of lung cancer cases. And we know that lung cancer is a leading cause of cancer death for American Indian men and women, and is the second most commonly diagnosed cancer among American Indian women and men. And this can be found in some of our resources on acaf.org as well, some of that data.
Thanks, Daanis. And I just had a question, I guess, as far as the impact of nicotine on the young brain. I know that brains are developing until the age of 25. And so by raising the age from 18 to 21, is there much of a benefit? And what is the benefit of raising that, that limit from 18 to 21, given that brain development is still continuing beyond that?
But yeah, I guess a big part of it, I don't know if somebody was talking. But yeah, I think like you said, brain development continues until you're about 25 years old. So it can really, anything younger than that, it can really affect the parts of the brain that's responsible for like attention, learning, and then memory as well.
Okay.
Not sure if that answered your question fully, but.
Great. And so I guess onto that, what are some of the benefits of having the purchase age of tobacco increased from 18 to 21 plus?
Right. So that can include, I guess, some of the benefits could be like taking legal purchasers out of high school, because 18 years old and even sometimes 19 or 20-year-olds can still be in high school and can purchase commercial tobacco. And they can also be a source for youth commercial tobacco users who are under the age of 18. Also, pushing back the legal purchasing age aligns with what we know about nicotine on the developing brain, like I just talked about. So again, we know that brain development continues until about 25 years old, and it can affect the learning, memory, and things like that of a younger brain. And then another benefit is simpler enforcement. Retailers that sell both commercial tobacco and alcohol only have one date to really focus on. And I know that from experience, just being a previously working at a gas station when I was younger, I know that those were sort of hard to keep up with. And then changing the age to 21 reduces the number of adolescents and young adults who start smoking. As I think I mentioned earlier, just like the targeting of younger people, especially within communities of color. And then changing the minimum legal smoking age can reduce smoking related deaths. And then it can also deter youth from smoking as well. So raising the minimum legal smoking age to 19 rather than the age of 21 wouldn't have much of an effect on reducing the social sources as well. So.
And thank you for expanding on that response, Daanis. I think that gave some really good information. So I guess going into the penalty aspect of of this, and I believe somebody in the comments had somebody had made a comment about enforcement. And so, what are some of the penalties if a retailer chooses not to comply with the sales age of keeping the sales limit for tobacco for 21 and plus?
Yeah, so the financial penalties are established by the FDA, and it depends on frequency over a period of time. So, and we see that in a lot of other enforcement measures that, you know, you have so many violations within a certain period of time, your penalty escalates from there. So for the federal penalties, the first violation, the retailer just receives a warning letter and they don't get a monetary fine. And then for the second violation within a 12-month period, the fine is $297. And the third in a 24-month period is $594. And then it goes up from there. And then also another penalty that is included is that the FDA has the ability to order a no tobacco sales order, is what it's called. And so that would suspend the retailer's ability to sell for a certain period of time. It's usually 7 to 30 days at the most that I've ever seen. And that's sort of that doesn't, it's just for frequently violating retailers. And so that doesn't have like a specific number of violations within a period. It's just the FDA, if they trigger that they are violating frequently, they're able to pursue that no tobacco sales order, which could be, depending on how many sales they typically have of commercial tobacco products, it could be more significant than the fine in some ways.
And then, so I think another question that came into the chat was a similar question to the same one. Isn't the critical issue that the enforcement on tribal lands? So who, if anyone, is entitled to and actually check to see if retailers on tribal lands are checking the IDs of those appearing to be under 21? So I guess, like, in a sense, like, what is the best way to ensure that compliance for T21 is met?
Right. So this is something that's worth talking about for sure. And I don't know if we maybe had this plan later, so I will say it now anyway. But so the FDA is tasked with doing compliance checks throughout the United States. And that would also include tribal lands, but they are dependent on having contractors do these checks. And so for the most part, unless a tribe has set up a contract to be able to do these checks on their own lands, those checks might not be happening on tribal lands, unfortunately. There's a lot of the contracts also go to state governments, and that I think that there are some arrangements where tribes will allow state contractors to do those checks, but because of tribal sovereignty, which is a good thing, there's kind of like not an ability to automatically go onto tribal lands unless there's some sort of agreement that's made. So the option is either within like the state that a tribe is in to make an agreement with that state agency or whoever does the checks in that state for the FDA, or to make their own agreement with the FDA and internally do those checks for retailers on tribal lands. And so I would say, I think 5 tribes historically have made contracts with the FDA to do those checks, but we know that there are lots and lots of tribes. So there's definitely room for thinking about how that can be enforced in tribal lands. And I think we'll talk about later too, how tribes can pursue policies and enforce them their own outside of the FDA and the federal approach as well.
Well, we can actually talk about that now. That's kind of next up here. So
Okay.
what are some other policies or ways that a tribe can consider besides adopting a T21 policy?
Right. So tribes could adopt a T21 policy, and they could adopt even Daanis obviously talked about how 25 is more of the magical number of when brain development ceases. And so, any lower or any other government could establish even a higher age than 21. There's no maximum age anyone could establish. So you could establish a policy like that, and actually establish their own system of penalties and fines and enforcement. And a tribe could do that, adopt their own policy about that. And then what else was I going to say? There's other policies that tribes could consider that would really impact youth use as well, and that some other governments have considered, such as prohibiting the sale of all flavored commercial tobacco products, which we know are very alluring to youth. And I don't know if Daanis or Chris want to jump in with any other things.
So I don't have anything to add here, but I was wondering if you could share a little bit more about how the licensing process works or could work for a tribe.
Yeah, so
in the question, so just
great.
curiosity.
Yeah, so tribes are sovereign nations, as we've said, and they can adopt their own policies and their own laws, ordinances, however it looks within their own tribal legal system. But in that vein, it's very likely that they could adopt what we would call as like a licensing policy, where to cover the enforcement of the licensing, they would actually require retailers within tribal lands to pay a licensing fee, typically, is what it looks like. And they could also establish that, retailers can't sell to anyone under 21 in that policy. They can't sell flavored products, lots of different policy options to sort of, they could say, no retailers could locate close to schools or parks or things like that. There's lots of different options you can say within that policy. And then typically you set up an enforcement where you regularly do checks 1 to 2 times a year, or sometimes it's based on how often the retailer has violated in the past. And then you can assess penalties if they haven't, if they fail their checks. And so typically the checks look like using a youth decoy to try to purchase them, and having either someone from Department of Health or possibly tribal police be there to sort of monitor that, or like set that whole thing up.
Nice. Thank you.
Yes, I have something. It's more of just like a thought to it. I was thinking about like the tribes that manufacture their own cigarettes, and how, what that kind of incentive would look like for like tribes, especially considering T21. This is just a thought.
And that was actually a question that came in as well. It was, what is the best approach to work with tribal communities that produce their own commercial cigarettes, like cigars and smokeless tobacco products? I think ACAF or Public Health Law Centers could touch on that.
I mean, I guess this is kind of like a community engagement piece, so I will definitely defer to Chris or Daanis if they want to talk about it. But I think that we all care about kids, right? And care about whether they are being exposed, whether they are being, put into environments that really encourage commercial tobacco use, which would cause a lifetime of addiction that's really hard to break. And so I think that even if a tribe was on the production side of things or the manufacturing side of things, I'm not sure that would necessarily be prohibitive to the retailer side of things, where kids would actually be buying these products instead of the manufacturer side. And I can let Chris and Daanis speak too.
I think this question is kind of getting more towards like the economic impact side of what T21 could look like for tribal nations. And so I know that we don't have a ton of information, around commercial tobacco sales, just because it's, heavily guarded by the tobacco industry. But there is some survey data that suggests that the sales of commercial tobacco products to those that are between 18 and 21 is a small fraction of those sales. And so it does not, really impact those retailers too heavily. So, I think that's something really good to look at as well, as like, okay, here's this economic data that we do have, and we're seeing that, tobacco 21 may not have that huge of an impact on that age, and, how they purchase commercial tobacco.
I guess while we're on the topic of youth, just to clarify, are there any penalties for the actual youth who are making these purchases or are in possession of tobacco underage, of these commercial tobacco products, I should say?
I could probably talk about this all day. At the federal level, there are no penalties for youth. But we do see those penalties sometimes in state law or local laws. And what we know historically about those penalties is that they were encouraged by the commercial tobacco industry to try to detract or take away resources from enforcement, to enforce more on youth than on the retailers themselves, who are the supply chain of commercial tobacco for youth. And so we see there's a lot of concern, and a lot of states and communities are actually removing these too, because we also know, and I think a lot of people have seen that at times youth, especially Black, Indigenous, and other youth of color, can be targeted by the police for these low-level crimes like possession or use or purchase of commercial tobacco products. And that's not that's not in line with our public health goals of like raising the health of all, to increase the interaction between police and youth in that way. And there's just really no evidence to show that they actually work. And we know that a lot as we get more into the science of addiction and what it means and how you address addiction. We know that harsh penalties just don't work. That's not what's going on. And that's what Daanis was saying about the neural pathways and the brain chemistry and what's going on, that harsh punishments to try to, force someone out of addiction is not what's going to work, because it's a brain chemistry thing. It's something that needs support, and that's not going to work well. I don't know if Daanis and Chris wanted to.
I think this is a good transition into like the next question here. So seeing as youth penalties are not encouraged, as Natalie has stated, what is a good way to talk to youth and young adults about commercial tobacco use?
Yeah, right. So I think what's really important is that you're just open and honest and direct with any youth, like maybe your children or youth that you work with or anything like that. You can really talk to them about the risks of using commercial tobacco, and that they're really more prone to nicotine addiction, as we talked about earlier, the delays with brain development, and then also that it can impact memory and concentration. And also the fact that, commercial tobacco contains thousands of harmful chemicals as well. And then I think one thing that I think about too is the research that we've done around tobacco messaging, and with public health organizations and their ability to, provide, messaging around utilizing traditional tobacco and things like that we found is really important within those studies. And then along those lines, you can talk to youth about how keeping tobacco sacred aligns with traditional values, and also connect youth with local traditional knowledge keepers. And even if you don't have access to those, ACAF right now is in the process of creating a traditional tobacco website where we interviewed traditional tobacco knowledge keepers throughout the United States, to provide some of that background information and things like that. And then also talking to youth about the intent of commercial tobacco, big tobacco, and how they spend billions of dollars to really make sure that their marketing tactics are appealing to youth and communities of color as well.
Daanis, I've also seen at least some research that suggests that teaching for tribal communities that have a traditional tobacco background, that teaching youth and talking about traditional tobacco does have like a protective effect. I don't think that so that like it's preventative in some ways. And I don't know if you have seen that research yourself, but I thought that I had seen that before too, which is another vote for that approach.
I also sorry, Daanis, go ahead.
No, go ahead, you can go.
I also just wanted to mention, to really reiterate what Daanis was saying about providing that education for youth and having those open dialogues and really supporting our youth, the youth who use the commercial tobacco, and really support them, you know, to get the support that they need and the help that they need to quit using commercial tobacco, rather than, you know, like berating them for it, because it is an addiction and it is a hard one to beat. And so just really being open and honest about having those conversations and not, you know, shying away from them because you don't want to have that hard conversation. So I think it's important to note that, you know, if you know any youth that smoke, that you can connect them to different commercial tobacco cessation programs that do exist. So I know like within Minnesota, we have My Life, My Quit, which is geared towards youth. The Truth Initiative has become an X program. I know there are different programming opportunities within schools and different universities, as well as different peer education models where we have youth talk to other youth about quitting and using commercial tobacco and things of that nature. So there are, you know, support opportunities out there for our youth who do smoke. So I think it's important to note that, you know, when they're ready to quit, there is help there. So just wanted to throw that out there.
I just have one other thing to throw out there about that too, is that I think what we're seeing from other addiction research, that addiction tends to be really isolating, and one of the best ways to help someone recover from addiction is to actually surround them with community and make them feel less isolated. And I think that community is one of the like absolute strengths of tribal communities. That's something that's of a high value and something that's inherently there. And so harnessing that makes a ton of sense in this circumstance.
Yeah, I think that just, you know, further highlights the importance of, you know, both learning and teaching our different, you know, cultural learnings around traditional tobacco and, you know, what that looks for, you know, your individual tribal nation. You know, I think we all have different ways of, you know, ways of, you know, harvesting and using traditional tobacco. And so I think it's important, you know, to learn that and, you know, really build on that, like you said, as a resiliency factor for our youth, but also for, you know, all of our generations. So
Thank you. And I do want to get into some of the questions that we have, but before we do that, just one more point I wanted you all to clarify. As far as the implications for spaces that were once like 18 or over, how do you proceed with, or how would you recommend that tribes proceed with making those changes in those areas, like casinos, for example, or places that have like tobacco vending machines where you once upon a time only had to be 18 years or older to use and access? Like, how is that shift being made?
Yeah, so this is one of the questions that we actually posed to the FDA, because this was one of the original questions that had us developing this resources, because vending machines, some people might not see them very often, but some tribes have expressed that they have vending machines still in casinos that are 18 plus, and the FDA is supposed to issue rules. They were supposed to issue rules summer of last year, and that hasn't happened. And so that's a very slow thing that's happening. So hopefully they will clarify whether they're going to change it to be that to have a vending machine, you have to be 21 plus. And so then for spaces that were previously 18 plus and had vending machines, they'll have to decide if they want to keep the vending machine, or if they want to raise the age for folks to be able to enter that space. Is basically the choice. And even if the FDA doesn't make that change and it remains 18, still, if someone from the age 19, 20, 18, 19, or 20 buys from the vending machine, still it's technically an illegal sale. Even if they were allowed to enter the space and the vending machine was there, they still should not be permitted to buy from it. So if you have a space like that, you would want to, see if you want to routinely kind of monitor it and make sure you don't see anyone younger than what should be purchasing from the vending machine.
yeah, I think this question also just like further highlights like the opportunities that tribal nations can, build on while they're thinking about this while we're waiting for the FDA to provide that clarification, I think it's important that tribes can start working on this right now. Think about these spaces within, say it's a tribal casino that is less, or, the age is under 21. Are there different opportunities where we could put those vending machines and say in a 21 plus only area, for instance, like a bar, something like that. Are there other areas where these machines could go, or do you want to get rid of them altogether and things like that? A lot of our tribal casinos do have different gift shops that have a lot of commercial tobacco sales within them as well. And so, there are other ways that, or areas that are being, that commercial tobacco is being sold. And so I think, it's just a really good opportunity for tribes to start thinking about that and having those conversations, especially with their tribal leadership, as well as, the tribal casino leadership as well. So.
Thank you for that. As far as what I have for you all, that is it. I'm going to go ahead and go into some of the Q&A questions. If anyone else has any questions, please be sure to drop them in the Q&A box. Somebody had asked if there are any sample or example policies and licensing procedures that people can reference. Natalie?
I don't know of any sample policies that are specific to tribal communities, but there are a lot of sample policies that could look really similar to what a tribe would want to implement themselves, because they're based on just a general licensing scheme. And we have some of those on our website. We have one, a Minnesota specific one, which also could be adapted for wherever you are. But I don't know of any specific sample policies, but I would also say that just as a plug, the Public Health Law Center, we are willing to help any community that's trying to adopt a policy like this write one. So we give that individualized, what we call technical assistance to any tribe or any government working within the United States. And so we are more than happy for you to reach out to us and help develop that policy if that's something you're interested in. And maybe then yours will become the sample policy to show other folks when we're asked that question.
Good point. Another question that we have here says, prior to the federal T21 law, did the federal government consult with tribes at all to mitigate any concerns or or ensure tribes have the capacity or resources to enforce this T21 policy? If they didn't, should they have, in your opinion? And this person asked because of the past efforts of the federal government's colonization efforts and oppression of tribes. And they were wondering if they can do better today to hear Native voices within this decision. And it was similar to, I'll allow you to address it, because I know we've had this conversations before.
Do you want me to answer that, Kristen?
You go first and then I'll add some.
Okay.
There's much to
we had a discussion about this. So Congress actually made this change, and not like the FDA as an agency. And we talked about that there is actually a specific executive order for agencies like the FDA to consult with tribes when they're making regulations that impact tribal communities, that have a significant impact on tribal communities. And I would say, I don't know of anything with Congress having reached out to any tribal communities. That's part of the process, kind of like opaque, that I don't know about. But my opinion of should they, of course, always, community engagement is always the best way to, adopt policy, to develop policy, to think about policy. And so that's like a good first step in any policy endeavor. And so I would agree that always the tribes should be consulted with, but I don't know that I'm doubtful that they had, because it also went through like a sort of it went through, I think, budget conciliation. And so it was kind of like a add-on as well to a different law that was being passed at the time.
Chris, Daanis, do you have anything to add?
I just wanted to add in also my thoughts on, if they should be required to do it. I think, always yes. We always want to make sure that all of the, policies and laws that are affecting our tribal communities, that we have a say in what they look like and how they're implemented and designed and drafted, all of that. I think that's really important that we have that opportunity to provide input. I think a lot of times that we can do a little better at it than that currently gets done now. So I think, yes, it should happen, but also there are opportunities for improvement.
Thank you. Another question here, do you foresee any potential issues to accessing traditional tobacco where commercial tobacco may be used ceremonially?
So we also had this conversation, and this will, we had this conversation around what will this look like and what will the impacts be for, say, a tribal nation who is still working on reclaiming their relationship to traditional tobacco. And so they still might use, say, like pouch commercial tobacco within like within their ceremonial practices. And so this will vary from community to community, as it isn't all used. And so I think that's really important, to think about as a community and how you want to address that.
And that goes back to what Chris was talking about earlier with tribal sovereignty as well, like applying your own laws and policies to, your own tribal community.
I see
And then that kind of just even brings me back to, sorry, Martha, but brings me back to that idea of, those who manufacture, cigarettes on their own reservation, and then they even like kind of name them, after like spiritual, give them spiritual names as well, is pretty interesting.
One thing we also talked about when we had this conversation was, to really use this as an opportunity to start having those conversations around traditional tobacco and how to access it, how to harvest it, how to grow it, things like that, like really using this as a springboard to get to that. I think that's really important to do as well.
Natalie,
I think there's a couple more questions in the Q&A.
I see here, and I know we're coming up at the end here, so I'll wrap them quick. Somebody had mentioned earlier that they had a barrier they had regarding youth inspection on tribal land is not wanting youth to inspect their own neighborhoods. Of course, they said that we resolve this issue in small towns by using youth from other areas. We have tried to talk to the FDA about sharing youth between state and tribal FDA programs to help address this issue, but have not made a lot of progress with the FDA on that front. And they would love to hear any suggestions and thoughts that you might have.
I think actually, this is an anonymous person, it seems like, in the Q&A. If you want to email me and talk about this later, I'm totally willing to see what we can do to find connections there to see what we can do. But that is a very good, valid point, that especially if youth are the clerks sometimes, when youth sometimes are selling commercial tobacco and sometimes they're clerks, and they don't, it becomes this awkward thing between this youth decoy and then the youth that are trying to, they're actually handling the sales too. So that's another sort of policy thing to think about what age of the retailers as well. But yes, it can cause like awkwardness or difficulties within a community. So I'm totally willing to see if we could have a conversation and brainstorm about connecting folks in some way to figuring that out.
Thank you. The last question that we have is, as sovereign nations, could tribes levy additional sales taxes on tobacco products sold on tribal land? And would you recommend that I would add on?
Yes, they can. Well, with caveat that unless the tribe has their own charter or their own ordinance or their own set of codes that says that they can't for some reason. But as long as there isn't a restriction internally with the tribe's own legal code, there's not, I can't think of any reason why they wouldn't be able to do sales tax.
So that's the last of the questions I have in the Q&A, and I'm not sure if I missed any in the chat. If anyone has any other questions, we will drop the contact information for both the ACAF panelists as well as Natalie at the Public Health Law Centers. I don't know if the panelists wanted to close out with the takeaway statement or anything that you think would be important for participants to leave with today.
I don't know if we mentioned it yet, but we did put together a resource about this as well that also has like our contact information on, and it's linked in the chat. Stephanie put it in there specifically about this that might answer some of these lingering questions if you haven't seen them. But if you do have questions after this and you want to reach out to me or any of the panelists, we're more than happy to answer those questions.
I also just wanted to say happy birthday, Natalie. I see
Oh,
you in the
thanks.
chat. I forgot about that. But also wanted to mention if anyone wants, physical copies of the resource, we do have some in our office at ACAF. So just feel free to reach out to Daanis or I. I also put the prevention@acaf.org email in the chat. So that is there as well.
Oh, and Hudson linked tribal tax policies for commercial tobacco, a resource that we have that I forgot. Thank you, Hudson, for linking that as well. Oh wait, he didn't link it to all. No, there he is. So that's in the chat as well, that we have a specific resource about that on our website as well, if you want to know more about taxes.
With all that being said, thank you all for joining and attending us today for this Tobacco 21 webinar. Stephanie, I know that you had mentioned that the live recording would be posted.
Yes, we will process the recording today and hopefully have it ready tomorrow afternoon. You will receive an email once that recording is ready and up on the Public Health Law Center website. So look for that email in your inbox.
Nice, thank you. And so I just wanted to go ahead and thank once again the American Indian Cancer Foundation, the Public Health Law Centers, and the Minnesota Department of Health, who played an instrumental part in creating the resource that we based this webinar on. Thank you all for coming, and please do reach out if you have any other questions. As we said, the panelist contact information is in the chat. Thank you all.